Thank you for inviting me today. My name is Jason Willett, and we will be discussing Rift Valley fever, which is a disease caused by a flebavirus that was discovered in Kenya in 1910, primarily in outbreaks in livestock. Transmission of the virus has been identified in domesticated animals through a mosquito vector. In humans, it's normally through transmission through contact with contaminated animal products. Human-to-human infection has not been demonstrated, but in high mosquito populations, mosquito-to-human infections have been observed. In animals, the virus causes in utero abortions of the fetus, as well as high death rates in newborns. In adults, it's usually more of an unspecified disease that can manifest as a respiratory illness, vomiting, and can also lead to death. In humans, for a large majority of infected individuals, the disease is asymptomatic to flu-like, and there are also 3 clinical presentations that are more severe. In the asymptomatic to mild flu-like presentation, patients normally recover within 1 week from onset of symptoms. These are the 3 more severe cases that will occur in 8 to 10% of the population. Ocular disease that can cause vision loss, encephalitis that has the potential to lead to neurological damage, and a hemorrhagic fever in less than 1% of infected individuals that can cause death. Distribution of the virus is in Africa. However, more recently, some outbreaks in the Middle East have been observed. The extended range of the virus can be attributed to a widespread of the larger range of the vector. However, it can also be attributed to transportation of the domesticated livestock between countries. For the more severe clinical presentation, this chart demonstrates the prevalence of the infections or the disease states from 2010 to 2016. We're looking at outbreaks in multiple countries. In red, you're looking at infected cases, and in orange, you're looking at the related death rate amongst those infected. In 2006-2007 outbreak in Kenya, there was a fairly comprehensive study or a investigation that was performed. To do this investigation, first had to identify the infected cases. It was clinical presentation. It was lab results for confirmation, serologies, IgM, IgG antibodies, as well as molecular assays. Patient occupation was really important to identify if there was exposure to animals. And then from there, it was identifying the geographic areas of concern where these individuals were coming from. What could have attributed? Was there a lot more weather? Was there weather events, a lot more rain, things like that to lead to that had the potential to affect mosquito populations to increase transmission rates. From there, did a larger data collection looking at the population that surrounded these geographic regions. You're looking at wide-scale surveillance through lab results, patient history, and questionnaires, and then testing any hypothesis. An example was the virus transferred through more wet soil, and it was found that more larvae was found in wet soil. One area that the investigation didn't really cover was the impact of vaccinations. So there is no real data from the Kenyan investigation whether or not there were any vaccination programs or vaccinations at all that were being performed in the area. And then in conclusion, in public health importance, we're looking at food supply with the domesticated animals. We're looking at overall population health because we're looking at widespread potential for infections. And then lastly, we're looking at global security concerns as it could be an agent in bioterrorism. I thank you for your time today and have a wonderful day.